All right. All right. So we are live, ladies and gentlemen. We always have a few gentlemen that love to join us here at the Liberation Lounge. And I am so incredibly excited today. This is the Liberation Lounge where we have real talk with real women. My name is April Joy, the host of this amazing show. And I'm so honored and privileged to have a woman that I have been watching from afar for a couple of years, right? One of my mentors always says, you never know who's watching you. And, she said, they may not always like, they may not always comment, but trust me, they're watching, right? And so this is someone that I have just seen really grow and develop and own her space. And I really have honored that. And I said, you know what? Given the fact that the month of May is mental health awareness month, I said, you know what? I could not think of a better person to bring on to the Liberation Lounge than a woman that I have just so much respect for. And so I'm not going to steal her thunder. I'm going to let her give all of you her background and what really brought her to this very important work. But today we are going to be discussing liberation in mental health as well as in public health because we got some things to discuss when it comes to that. So, ladies and our allied gentlemen who are with us live, or if you're watching us on replay, please welcome to the virtual stage my dear friend, Ashley Glass. Ashley, how are you today?
I'm doing great. And thank you so much, April. I truly appreciate you giving me this opportunity to come on your podcast and
Oh
appreciate
my God.
all the work that you're doing. I have watched a few, been able to share some on my social media. So just appreciate all the work that you're doing too as well.
Well, thank you
Yeah.
so much. And I'm so excited to get into the conversation and the important work that you're doing. And so, for those who may not be familiar with you and your background and really what brought you to this work, right? You have an amazing nonprofit, Black Women Cultivating Change, which does some phenomenal advocacy here throughout the greater Cincinnati region and maybe even beyond. I'll let you speak to that. But maybe you can just let our listeners first just know a little bit about you, your background, and what really brought you to this important work.
Sure. So my background is in public health. I've been in public health now, I think, for a little over 14 years, and really have worked in the child maternal health space, as well as at different hospital systems, federally qualified health centers. But I've really always, when I look back, been an advocate for community. I'm also a registered nurse, and currently I work in corrections. So again, love working with kind of underserved populations and that sort of thing. And this allows me to, deliver high quality care to people that you would not typically think of when you think of nursing and all of that.
Hmm.
Actually, I
Hmm.
would have never guessed I would have been in corrections, but I am loving it. So,
That's awesome.
and then I also work for like a health insurance agency. It's Medicaid. So again, we serve those underserved populations, but focus
Yeah.
on health equity, but under quality. So for people who maybe where it's like NCQA quality measures and different things like that. So we look at how to measure how impactful our programming is for our members. Um,
Okay.
Yes, and then as far as Black Women Cultivating Change, that is
Hmm.
like my true passion
Hmm.
project and work. I founded that 3 years ago. It was during COVID, and just really had the time to really do some healing of my own,
Hmm.
and felt like I was in a space that I wanted to be able to provide and connect people to the resources I was connected to so that they can start their healing journey.
Yes.
Yes. And so just seeing, and going through my own struggles as well as friends, family
Hmm.
members, and even just different people out in the community, that is what kind of made me want to start Black Women Cultivating Change. And we've been kind of
Hmm.
going ever since. So um right now, we kind of serve our biggest audience is women.
Hmm.
We are able to do some programming for girls too and help support that as well. And then we even include men as well because
Hmm.
we know it's really about everyone. Everybody kind of works
Yes.
together. And
Hmm.
so we don't want to exclude any gender or,
Yeah.
things like that. So we try to really work with everybody as well as other cultures too. We
Hmm.
are partnering soon with a Hispanic organization, and we really want to look at maternal
Hmm.
mental health, because a lot of we're finding other minorities are kind of experiencing the same things we are as the Black
Yeah.
community. So just excited about kind of the work that we're doing. So
Mhm.
that's a little bit about us and me.
Awesome.
Yeah.
Awesome. Absolutely awesome. Such important work. And I think everybody knows somebody, right, who's been affected. And certainly we all were affected,
Yeah.
by the pandemic. And
Oh
I think
yeah.
that's really what began to elevate mental health, right?
Yeah.
I mean, my mother, God rest her soul, she, um, years ago, before she had me, she was living in California and just the stress of being a mom and trying to
Hmm.
get her teaching certification and,
Yeah.
taking care of kids and her husband being in the military and not really making enough money, to
Yeah.
support the family. I mean, she was borderline nervous breakdown,
Hmm.
right?
Yeah.
And so I'm very conscientious of my own mental health because I know what can happen to all of us, but certainly as
Absolutely.
women, when we don't really practice good self-care,
Hmm.
right? And I know everybody thinks self-care is going to the spa. That's not self-care.
Yeah.
I'm gonna debunk that today.
Yes.
Okay.
That's very
Self-care
superficial.
it's very superficial,
Yeah.
very superficial. I mean, even this morning when I was on my morning walk, which I tend to walk, at least in the summer, very early, like 6:30, 7 o'clock. And I said, you know what? I'm just gonna go into the grass and I'm gonna do some grounding for 15
Hmm.
minutes. Right. And
Hmm.
people don't understand even just the power of simple things like that to really get you connected to the
Yeah.
magnetic field within the earth. Right. So
Yeah.
there's just so many things that we can do to support ourselves. And so let's talk about, a little bit more about kind of some of the disparities that you've seen. When did
Sure.
you really first realize that there was a disconnect between public health systems and the lived experiences of Black women? When did that become really apparent to you?
I would have to say, when it became very apparent to me when so with a background in public health, we learn about these disparities, but it still
Yep.
wasn't truly hitting home for me at that age
Mhm.
and all that.
Mhm.
It really hit me when because I had my oldest daughter,
Mhm.
towards me graduating, with my undergraduate degree, but I start working in maternal health and started learning about the disparities Black women face as far as, the childbirth process and even just
Yeah.
reproductively and all of that and
Yeah.
historically, and just
Mhm.
being taken back by how long this has been going on. So like this
Yep.
wasn't like a new thing. This has like been
Right.
going on for years, and just not knowing about it. And
Mhm.
I think that's when it really, I guess, hit me, is when I start
Yep.
actually working in that field and hearing the
Mhm.
voices of the women, as well as thinking back to my story, and
Mhm.
how I experienced care, and when sometimes when you're receiving care, you don't know that you're not receiving the most equitable care, I guess is the best
Yep.
way for me to put it. If you don't know what to
Yep.
measure it against, or you don't know what services and programs are being provided to others. Um, and just really thinking like, man, this is not only is this a huge issue,
Mhm.
but I still don't believe our community is aware of it. I mean, even
Yeah.
now, because I work in healthcare, I'm close to it, and I think a lot of people who work in healthcare, we have this misconception that since we know about all the disparities, the public knows
Mhm.
about the disparities.
Yep.
And I still think there's a disconnect. I talk to people all the time, like, have you ever heard of maternal mortality, infant
Yep.
mortality? All
Mhm.
these, and there's still people like, no, what are you talking about? And so I think we need to do a better job at educating the public. um,
Mhm.
and there are people who are aware of it. I would say people maybe more with an academic background
Yep.
or certain class level, that sort of thing, but still the general public, I think, still really has no idea what's truly going on, when it comes to the disparities within the health system, these systemic
Yep.
barriers, and all of that. So, yeah, I think we need to do a better job making it easier for people to understand, like the healthcare information, using the healthcare jargon, all of that,
Mhm.
being better at health literacy. And yeah, so it's a lot of work we still have to do. I think we have a lot of work to do.
I totally
Yeah.
agree with you, and I was watching a podcast with Melinda French Gates, which is like she's like my sister from another mister right now. Yeah, me and her, we're gonna be friends one day. I don't know when and I don't know how, but our paths are going to cross one day. But I saw her on a podcast recently, and she was discussing some of this, and she said,
Mm-hmm.
people don't understand that women of color are
Yes.
disproportionately
Yeah.
at risk when they're having children inside
Mm-hmm.
of a hospital.
Yeah.
Like they could die
Mm-hmm.
in the hospital
Yeah.
because of these health disparities. So this is not anything to be taken lightly,
No.
y'all. This is serious stuff. And I mean, my mom had 7 kids, right? And so I remember my mom, even as a young girl, I was probably a preteen, I would
Mm-hmm.
say. And I remember her even saying to me, I mean, I remember this like yesterday. She said, the closest that you will ever get to death is when you're having a child.
Wow. Wow.
And I was like, wow,
Mm-hmm.
okay. Let me definitely make sure if I go down the childbearing path that I get some good health care.
Mm-hmm.
But I think
Yeah.
that mindset came one, my mom was born in 1937, right?
Mm-hmm.
But I think that mindset also came because of the things that she
Yeah.
saw, not just how she was treated,
Mm-hmm.
but also how other women in our family were treated
Absolutely. Mm-hmm.
and how her friends were treated,
Yeah.
right? And so yeah, I could not agree with you more. There's a lot of awareness that still needs to happen. And so let's talk about the pivotal moment when you knew your voice and your work could really create change. Like, was there a moment that you can just recall where you're like, oh my gosh, I know that I'm really making a difference right now? Like, what sticks out for you?
What sticks out for me is a couple years ago, we had decided as an organization to do a professional development conference.
Okay.
And I just remember at that time I had a lot going on professionally, personally. But we were able to bring together all of our community partners and see, like, is this really going to work? Is this something that the community wants and needs?
Yeah.
And I think the moment we did that conference, I was like, oh my gosh, we actually really do have a lot of people supporting us and are connected to a lot of people, and this is
Yeah.
needed. And it was just beautiful because everybody kind of came together and it was a beautiful experience for everyone.
Yeah.
Not just us as an organization, but just being able to see people um, feel like they had a safe space to not only learn about Black mental health, but
Yeah.
be authentically themselves. I mean, people were showing up in like these cool t-shirts with cool slogans on them, and we were
Yeah.
talking about like Narcan
Mhm.
and Narcan is like a drug used to bring people back from overdose. But it was
Yep.
just like this, I don't know. It was a powerful moment to which I
Yep.
was like, okay, yes, this is bigger than me. We need this so that people can come as they are and feel that they'll be, taken care of in the, equitable way and feel safe
Yep.
to share if they are going through mental health challenges. And if they are,
Yes.
it's okay.
Yep.
We all have experience, whether it was internally with ourselves or with friends or family, like you said at the beginning.
Yep.
And we need to talk about these things. And I think that was one. There's many things, but that was one that comes to mind. There's another, and I know you said share one, but I have one
Oh
more.
yeah, sure.
Yeah, we had done a an event on sexual assault, and I
Mm.
remember asking people in my network if they would be speakers. And unbeknownst to me, some of the people I asked, I had not known like their personal history and all of that.
Yep.
But having people come up to me after the event and saying, that's the first time I ever felt safe enough to share my story. You have no
Wow.
idea. And, just
Wow.
seeing again that release from people to live in their truth and be their authentic self. I think that's the most empowering thing to me is when I see people comfortable enough to be themselves, not feel judged, and yeah, just share whatever they would like to and then be received in a healthy, positive way. That's to me, that's the magic in it all.
That
So
is the magic.
yeah.
That is the magic. And I heard
Mhm.
two really powerful things in what you just said. In the first example, you used a term that I think is so critical when it comes to talking about, issues like this. And the term is safe space,
Yeah.
right? And that's really what you've created. You've created this safe space and almost kind of like demystified and destigmatized,
Mhm,
right?
mhm.
Some of these issues that many of us are going through
Yeah,
personally, or we know others who have, and you've created that safe space, which I think is huge. And I think the other thing that is really poignant about what you just said is, trauma is a word that we use a lot.
yeah.
And a good friend of mine, when I went through my divorce, a good friend of mine, I was sharing with her experiences that I had when I was married.
Mhm,
And she said, April, that's trauma. And I had always related trauma to like physical
mhm,
trauma.
mhm.
Like, like I had been, I was never like punched or hit or
Yeah,
anything like that. But there were definitely examples that I gave to her, and I'm just talking about it kind of flippant,
yeah.
and she's like, "No, that's trauma,
Mhm.
April. Like that is trauma." And
Yeah,
I was like, "Oh my god, I never put 2 and 2 together."
yeah.
That's actually what I had experienced in my trauma. Now she was, a victim of, um, pretty bad domestic violence in a
Okay.
previous marriage,
Mhm.
right? And so she had done some work and a lot of study around this, and also had worked with some women, right, to help them kind of go through that transition. So I trusted her, right?
Yeah,
Because this was not only a part of her experience, but she had also counseled some women over the years to get through that. And I just remember thinking to myself, gosh, we've got it all wrong out here.
yeah. Yeah,
We got it all wrong. We
for
got it all
sure,
wrong.
for
Yeah,
sure.
I mean, oftentimes it's like, "Oh, well, I didn't get hit." Well, they never hit me. It's like, well, that's not what we're talking about here
Yeah.
completely. Like, that's
Mhm,
part of it, but
mhm.
we're also talking about the, emotional abuse, right? We're
Yeah,
talking about just the inability to really just stand in your truth and be authentic, like,
yeah,
that's trauma, right?
for
And
sure.
so I was really educated, through my healing process, and she played a big part of that. So I really appreciate some of these things that you're talking about. And ladies and the gents that are, watching us live or on replay, understand that there are women and even men in your life right now that you would
Yep,
never
yep.
guess are going through sexual assault,
Mhm,
domestic violence.
mhm.
You would never guess it,
Very
right?
true.
And so the fact that you're creating this space for women and men to be able to communicate about this, I think is huge. It's absolutely huge.
Thank
So
you. And
thank you for
I
that work.
will say some people do not like the term safe space. I continue to use it because I feel like it is, but there are some that are like, how can you, say that it's going to be
Sure.
safe for everybody? But we still use it because I really
Yeah.
think, but
Yeah. Yeah,
yeah,
absolutely. My mom used to always say you can't please everybody, and
yeah,
that's
that
okay,
is true.
right? So, let's talk about, some of the systemic barriers.
Hmm.
Okay, the systemic barriers. So, what systemic barriers do Black women face when trying to access quality mental health care, or even physical health care? Like, what
Healthcare in
what have you
general.
really seen, just in general?
So, in general, I would say, a lot of times, depending on your insurance, so let's talk about even insurance can be a
Yep.
barrier, if you want certain, uh, so let's say, for instance, you want a doula, which is someone
Oh
to kind of
yeah.
walk with you and support you through your pregnancy journey. There
Yep.
is, we have seen some improvements as far as some insurances covering that service, but
Yep.
sometimes you might not be able to cover throughout your whole pregnancy or,
Yep.
even post pregnancy during that postpartum period, just
Mhm.
because of the cost. So that's a barrier. Um, as well as sometimes there's a wait list getting in to be seen.
Mhm.
I know, and
Mhm.
this is something I'm sharing. I have 3 children right now, but I was pregnant a total of 4 times. And I
Okay.
remember the pregnancy, which I had a miscarriage. I could not find a provider. Like I couldn't get in. There was like all these long waiting lists, and I was
Mm.
experiencing pain and different things like that. But I'm like, all right, well, I'll just wait. I'll just wait. I'll just wait. And then by the time I had seen someone who was in the emergency room and I had found out
Wow.
she was miscarrying. So just,
Wow.
being put on wait list. Also, if you are a single mom or just a mom who's working, sometimes there's the appointments are only during the day when you're, during work hours. So how are you supposed
Right.
to, if you don't have a job that understands you need to take off and go to an
Yeah.
appointment, all of that, or even if you're a student, juggling many things. So just even the hours of care. And then if you miss an appointment, sometimes they'll, take you off of their or out of their practice because you're not compliant in their eyes or whatever.
Yeah.
Not knowing all it takes for you to get to that appointment.
Hmm.
So those are some things I'm seeing also in the healthcare space, since I am a registered nurse. Academically, I think there's still a lot of work to do when it comes to educating our healthcare providers on how to adequately care for diverse populations. So you
Mm.
may get a smidgen of information during school on how to work with minority populations. And that's huge, especially if you're not a minority yourself. You
Yep.
really need to know how to interact and care for people of different cultures or, of different
Yes.
races. And so I think we have a lot of work to do still in that area as well. And so that's why I think we are seeing these health disparities because when you think about academic systems as well as hospital systems, even the structure of it all, we just still have a lot of work to do. So
Yep.
um, a lot of my old boss always told me never blame it on the people who are receiving the care. It's more our job, our duty. If something goes wrong, it's the people providing the care. What can
Mm.
we do different? While we're providing this care, while we're giving these resources to community, how can we truly serve our communities better? And so not always putting it on the mom or, the dad or the family members. A
Yep.
lot of times you'll hear, we as a Black community can't get it right. We need to start with home. Yes, that is very important, but we also have systems who really need to change their policies, practices, and what they've been doing for years. Because obviously, if we still have these same disparities going on,
Yep.
there needs to be some change. And so we can't just always put it on the communities. We need to put it on the system side too, as well.
So let's kind of play that out, right? I mean, so we're talking about some systemic barriers that are, currently prohibiting, that equal care or that
Mhm.
equity in care. I mean, are there legislative things that need to get passed? Are
Mhm.
there practices that need
Mhm.
to adjust in the academic system? Like, what
Yeah.
does that need to look like
Yeah.
in order for us to really begin to see some progress?
Yeah. One thing that comes to mind, especially when we're talking about mental health, is, and this is one thing I don't never understood, but we've separated from healthcare, and so
Oh,
it's
yeah.
not treated the same as physical health things.
Yes.
And so
Yeah.
what you're seeing is lower reimbursement rates. So how much people who provide mental health services, they don't get an adequate amount, honestly, for the services
Yep.
they provide. And
Yep.
so we see a lot of turnover. We see a lot of minority providers, they'll start private practices because they know then
Mm.
they can, charge, and not necessarily, some of them will accept some insurances, but some of them will even just do private pay,
Yep.
which, I mean, it creates this lack of, minority providers. And
Hmm.
yeah, so in a nutshell, I think mental health, one, should have higher reimbursement rates.
Yep.
Also, with healthcare in general, not just mental health, also physical health too as well. We need more
Yep.
diverse providers, period, all across the board.
Yep.
And so the process in becoming a provider, whether it's medical, behavioral health, needs to be a more equitable process. There's a shortage right now in behavioral health. There's a shortage of nurses. There's a shortage of
Yep.
physicians. And
Yep.
honestly, if we could get the process together, I don't think we would have a shortage. I don't think there's a lack of minorities with interest in going into these professions. I think that they've made the pathways so challenging. And it's hard to get through these programs if you are not privileged. That's just simple
Yep.
as that.
Yep. Yep.
And then even once you get through these programs to get certain certifications to practice and different things like that, that's another barrier. A lot of the testing is not culturally competent. So you see
Yep.
a lot of minorities, they might have graduated with a nursing degree or
Yep.
clinical degree, social work degree, but they can't pass their exam because these
Mhm.
exams, to me, this is just my preference,
Yeah.
Ashley, they don't even, you have to go into this imaginary world and like
Mhm.
shut out everything you're doing in the real world to pass these exams. Like they
Yep.
don't translate to real practice. And so there's a
Mm.
lag in that too. I think there needs just to be a lot of work done as far as academically as well as in the field too. So, like I
Yeah.
said, as far as policy wise, advocating for reimbursement rates, excuse me. Also, you see childcare being a huge topic right now. That's another workforce that was hit, especially after COVID, but they're
Yep.
not childcare and teachers. They're not compensated enough for all that they do for,
Oh, not even close.
and so we just really need to take a deep dive into these professions that are truly play a huge role in us being, living healthy and being productive citizens. If we can't get that thing together, which is investing in these professions that
Yep.
we know lead to success for individuals and communities, we'll always be behind. So,
And I love what you're talking about here because, again, I'm gonna go back and reference Melinda French Gates,
mhm,
but she talked about this in her podcast with Jay Shetty, and she said, we need to have women and persons of color in every
oh
sector
yeah,
of leadership in
yes,
society because it needs to be truly representative,
hmm,
right? And so I'm on a leadership team of an organization called Conscious Capitalism. There's chapters all across the world. And, we believe in utilizing business as a force for good.
hmm,
So while DEI and many of these other things are currently under attack, businesses that have continued to practice those ways of doing business equitably
hmm,
do so because they know that it's good for business,
yes.
right?
Overall, yes, for everyone.
Overall, they just
Yeah.
know it, right? They're like, we're
Yeah.
not gonna stop having a
Uh-huh.
diverse workforce. We're just not,
Yeah, it doesn't make sense.
I mean, it just doesn't make
Yeah.
sense for us. Even financially, it
Hmm.
doesn't make sense,
Yeah.
right? But let know morally
Yeah.
or ethically, but
Yeah.
even financially, it doesn't make sense. And I, so when I sit in these conversations with my conscious capitalism colleagues, I think to myself, how do we translate this on a government perspective?
Hmm.
Like, why is this not coming
Yeah.
together in our forms of government,
Yeah.
right? And I think if we can figure that piece out, like what you're talking about, it's like, okay, you know what? If I'm going to go to school to be a physician or to be a nurse practitioner or to be in behavioral health, I need to ensure that as I go through my learning and my academic career, that, I am learning
Hmm.
about the cultures that
Yeah.
I am going to serve,
Yeah.
right? And also, it would be wise for me, especially if I had, I went off and started my own practice at some point, that I hired other people
Hmm.
that were representative of the patients
Yeah.
that I serve,
Hmm.
right? And so it's like, if there are businesses that are understanding this, if we can get government to understand this, and if we can get academia to
Yeah.
understand this, then that's really where I think we can start to see some positive change,
Yeah.
right? And so, yeah, I absolutely love, love, love what you're talking about. So let's kind of wrap this up a little bit.
Mhm.
So, um, what kinds of programs and initiatives has Black Women Cultivating Change launched to kind of bridge this gap in care? Or maybe there's things that you guys are working on or that you're going to be launching soon
Yeah.
and inviting the community to participate that you would want our listeners to know about.
Absolutely. Well, I will start with something new that we are excited about is we are collaborating with another nonprofit organization. I kind of mentioned this earlier, which is similar to ours, instead it focuses on Hispanic women and their
Yep.
population.
Mhm.
And so we're collaborating with them to co-create some maternal mental health programming and public awareness campaigns.
Mhm.
Because I was a part of a study previously, and the resounding answer from all the moms was they do not feel like anybody's paying attention to their mental health
Mhm.
at all. So that means family members, friends, community, partners, and then even the clinicians. They don't feel like they can truly, share if they're going through any mental health challenges or barriers, or, what's going to happen if I do share? Are you truly going to help me? What is that going to look like? All of that. And so that's something we are gearing up to start working on. Also, we host a annual professional development conference. We hear
Mm.
loud and clear that there's not enough culturally competent education for providers. So we offer that. And so we offer free CEUs and different things
Wow.
like that. And it's open to not only Black providers and clinicians, but we want everyone to come to learn more about
Yep.
how they can truly serve the Black community.
Yep.
Um, and then we have our annual mental awareness community celebration as well coming up this month in May. So we're excited about
Yep.
that. It'll be at the United Way, and we like to pull in non-traditional leaders in the community that make a huge impact on people's mental health that you wouldn't traditionally think about. So we've got a spoken word artist, we've got
Mm.
a beautician, as well as two fashion designers.
Mhm.
And then we're also going to just educate people on the disparities that we're facing as a community right now, and so that they know what's going on and how they can be connected to resources to navigate those. And so those are the things that kind of pop out for me, but we also try to do a quarterly event. We try to make all of our events free of charge because we never want cost to be a barrier for anyone.
Yep.
And yeah, and we are always open to suggestions. If anybody has any suggestions on any topics we need to discuss, or, if they need resources or even connected to a therapist, we're very connected to the behavioral health resources here, as well as providers too, as well. So we love to just,
Awesome.
even if we get direct messages or calls or things like that, still love to just connect people to resources too, as well.
And I gotta tell you, like, being a part of your Facebook group has been, like, so empowering for
Oh,
me.
good. I'm glad to
Just
hear
to
that.
see yes,
Yeah.
just to see, like, all the work that you guys are doing, and
Mhm.
so, and you guys certainly please do like Black Women Cultivating Change. I know you have a public Facebook page,
Yes.
as well, but I just think, the work that you guys are just is doing is just so incredibly important, and I just want more people to know, A, know that you guys exist, and B, to know how they can get plugged in,
Hmm.
right? How
Yes.
they can get plugged in, and so I'm just super, super excited about the amazing work that you guys continue to do, how you're really uplifting voices, right? That may otherwise be silenced or just unheard,
Yeah.
right? And I love one of the things that you said there towards the end, which was, you know, oftentimes, eh, I think sometimes women feel like, oh, if I bring this issue up, am I going to be heard? Are people really
Hmm.
going to believe me
Yeah.
that I'm suffering from depression
Yeah.
or whatever? Or are they going to say, oh, it's just all in your head and
Hmm.
brush it off or whatever,
Yeah.
right? And so that's the part of the systemic issues that we have.
Yeah.
There is also a responsibility on us as women to not feel like we have to be super women,
Yes. Yeah.
right? And so be okay with taking the cape off,
Yeah.
ladies. Be okay with taking the cape off, and be okay with really voicing what the real issues are that are going on in your life. And I'm taking responsibility for this because I know that when I was married, I was totally faking it for a
Hmm.
while. Like,
Yeah.
faking because I didn't want other people to know that I was suffering
Yeah.
as much as I was suffering,
Yeah.
right? Because why? I thought, oh my gosh, that would be a sign of weakness, or how is it going to make
Hmm.
him look, right?
Yeah.
And so it was really a challenge for me to even gain the confidence
Yeah.
to finally say, you know what, there's a problem here.
Yeah.
And I need to be okay with voicing that problem. And I remember having the conversations with one of my girlfriends,
Hmm.
and she's like, her first thing that she said to me was, I had no idea.
Yeah.
I
Yeah.
had no idea that you were going through this because on the outside, y'all look like you got it all together.
Hmm.
And
Mhm.
honey, we did not. It was a hot mess
Yeah.
up in our household, right? A
I
hot mess.
understand. Yes.
And so that would be my message to the women that are listening right now is if there is something that is really going on, stop pretending
Yes.
that if you're pretending that everything's great and everything's fine and da 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 da, stop pretending and get real about what's really transpiring within your life. Get real with yourself first. And if that requires you to have a conversation with a behavioral health specialist, to get a therapist, I mean, it's like we spend money on a lot of things. Some people say, well, I can't really afford it. Well, it's like, you know what? No Starbucks, no fast food, no eating out for the next 30 days. That might be your
Yeah.
session right
Yeah.
there, right? And so we also, I think, as women, just have to learn how to prioritize. And that is
Mhm.
not discounting at all
Yeah.
the financial disparities that are happening within our
Mhm.
community. There are women who truly cannot afford to
Yeah.
get some of the care that they need. So I'm not discounting that at all.
Yeah.
But I also think it's important that we begin to take some personal responsibility along the way for our own mental and physical health, right? And I think the first piece of that is just acknowledging what's really going on and stop pretending in
Mhm.
some cases like everything like everything's good. I remember I went live probably about, I don't know, 8 months after my divorce, and I said I was acting like everything was okay, but I was not okay. I was
Mhm.
so not okay,
Mhm.
right? And when I kind of came public about that, many people were just shocked,
Mhm.
and what that showed me was how much oftentimes as women we hide our pain, we
Yeah.
hide our suffering. And so if that's you listening in right now, first of all, we want to say we love you. We appreciate you. We're here to uplift you and give you access to the tools, the resources, and the confidence to be able to elevate your voice and to say, hey, that's me and I need some help,
Yeah.
right? And so please do plug into the work that Ashley is doing with Black Women Cultivating Change. Please follow them. And so, any final words or thoughts, Ashley, that you would like our listeners to hear or that you want to pay forward as we wrap up today's episode?
No, just want to say thank you so much again, and just want to reiterate, I don't have it all together. I'm not coming on here
Right,
saying, you know what, I'm all the way fixed and I've got everything perfect in my, as
girl.
you were talking, I wanted to make sure I said that because I don't
Yes,
want people to think that, I don't have bad days or, I am perfectly healed or anything of that nature. No, what
yep,
I'm saying is exactly what you just said is
yep,
please don't be afraid to be your authentic self.
yes,
Reach out to someone if you are experiencing any challenges or barriers. Suicide rates are also going up in our community, and we're not talking
yes,
about that.
yep,
And so, just, there's a national hotline, 988. You can also call that hotline if you need help with that. But just know that you matter, and no matter what you're going through, just know that. That we need you here. There's a purpose for your life, and
yes,
we need you here. That is
yeah,
my thing, and you are allowed to live a healthy, happy life, and that's something I
yes,
dealt with too. Just guilt, thinking I made too many of the wrong decisions, or not
yep,
having that picture perfect family, or whatever the case
yep,
may be. Just know that we need you here, and we appreciate you, no matter who you are. Um,
yep.
yeah. So that is my last statement.
Oh, that's
Yeah.
lovely. That's lovely. And I know that that touched somebody today. I know that it did. And so, Ashley, thank you so much for sharing your heart, your mission, and just being true to who you are. It makes a difference. So thank you.
Thank
So,
you.
ladies and our allied gentlemen, that episode 18, is a wrap for the Liberation Lounge, where we have real talk with real women. We look forward to seeing you again next Tuesday at 12 p.m. Eastern. We do periodically also have episodes in the evening where we do Liberation Lounge after dark, because I heard you. I'm at work. I can't pipe
Yeah.
in and listen. No problem. And also, even if you can't catch us live, all these episodes are being archived and load it onto my YouTube channel. So please subscribe at April Joy Empowers. Again, that's at sign April Joy Empowers on YouTube. You can see all the episodes they drop every single week. Okay. Thanks so much, everybody. Appreciate you. Love you. Ashley, thank you so much for your time today. And we
Thank
look forward to
you.
seeing everybody again next week. Bye for now.